Incontinence, pelvic floor disorders, erectile dysfunction. Millions of men and women are living with those things.
Yet may be reluctant to ever talk to their doctors. As we imagine better health, why those discussions are important and some of the innovations and treatments available today.
Here with us from CHI Health, urologist and urogynecologist Michael Feloney. Thanks for stopping in, doctor.
It's nice to have you back.
Yes. Okay, let's start with urinary.
Thanks for having
me. No, let's start with urinary incontinence. What is it? How does this happen? How does this occur? What are the symptoms?
Urinary incontinence is the loss of urine basically through the urethra when you don't want it to happen. And it happens because of different mechanisms of action, lack of musculature, neurological problems. Happens more so with age. There's different types of urinary incontinence. One of them is stress urinary incontinence, where you leak with increases in intra-abdominal pressure, like with coughing or exercising. There's another type of incontinence called urge urinary incontinence, and that's that gotta go incontinence, where you can't hold it and you're running to the restroom and leak on the way. And then there's a third type of incontinence, which is like paradoxical. It's overflow incontinence, where you leak because you're so full of just kind of water going over the dam. And those are basically the three types of incontinences, and we have many treatment options for them.
In both men and women?
In both men and women.
Those three.
There's millions of men and women with urinary incontinence. The prevalence rates are lower between men and women. Women obviously have higher rates of incontinence, however, especially when they're younger. But as men and women age, the prevalence rates are closer together. And it ends up being about prevalence rates for women, about 50% of women will have, about 50% of women will have some sort of urinary incontinence, and about 25% of men over 60. And so they increase as they age.
We are looking at options for treatment. This is both men and women.
Correct. Basically, this very similar options for men and women. Now, similar options in the categories, but the exact treatments are different.
So which on these lifestyle changes we understand, exercises we understand, something like bladder injections, nerve stimulation, medication, surgery, that's where the innovation comes in.
That's where the innovations are, especially the medications. In the last 5 years, they got a brand new agent that uses different receptors on the bladder than traditional parasympathetic receptors or muscarinic receptors. They're using the beta-3, the sympathetic receptors now, to help relax the bladder, and that's the new innovation with for oral pharmaceuticals. There's also Botox, where you can inject Botox directly into the bladder to relax that bladder for overactive bladder.
Some of these treatment options, they're fascinating. And then you brought some examples in, and you have a device down there that kind of looks like a pacemaker.
Correct.
And how does this thing work?
Well, it is. We kind of call it's called InterStim. It's sacral neuromodulation. This is what the batteries and the computer. This is like a little computer. It's a battery. And this is what it was at the beginning. And now they've come down in size. They've halved it. And now they're also coming out with a new one, even smaller. It's going to be smaller, but they're not quite out with it yet. But very, very small, very thin as a pack of gum.
So this
where
is
does
what
it go?
we have now.
That would
Where
go
does it
in.
implant?
So it implants. If this is the lower half of the human body, for InterStim, it would go right here in that fat pad over in the buttock area, just above one of the buttock.
And there's a lead from there, right?
Yes, and there's a lead that connects the battery to the nerve, and it goes right through this foramina right here, the third sacral foramina, if everyone can see here.
So our bodies already have a little opening there.
We have an opening to get to the nerve, and so this will send electrical pulses to the nerve to tell it, hey, calm down, or hey, you need to do a better job in urination, because you can use this device for retention or that overflow incontinence or urge incontinence, overactive bladder. And the patient will have their own controller. They can go up and down, change the programs
based on what they're feeling.
based on what's going on.
Yeah,
correct.
what they're
so they can change. Yeah,
so
they
it's
can
a
change
wireless programmer that
That's
it
awesome.
basically
Wireless.
talks to the device.
Correct. It will talk to the device, and they can hold up to 4 programs, but there's thousands of programs you can use.
We have so much. I wish we had a ton of time with you. Like, don't
and
you?
what,
So
no, I do.
fascinating.
And what's this other thing you brought in? What else
So
did
I
you bring
also
in?
have, for stress incontinence, these are the latest and greatest for stress incontinence for women. These are mid-urethral slings. And so if a woman's laying on her back for the surgery, to put it in, there's a trocar that would place the sling around here on either side and would act like a hammock around the urethra to basically stabilize the urethra. And there's different, I have different options. One goes up through the abdomen, another one will go through the obturator foramen.
So that supports
depending on,
the urethra?
Yeah, it'll basically support the urethra, to say it simply.
That's so simple to see this, but to understand the difference that it makes for patients.
And there's one for men as
And
well.
then you brought in this box, which has never been opened.
Never been opened. So for men, there's also slings, and I'm going to open for the first time. The company sent me a sling so I can show the audience, and I'm going to open it for the first time. So this is what the surgeon would get at the operating room table. They would open this box, and this is what I'm even kind of curious how it's how it's back, because I'm just usually sitting there, and they usually hand it all to me.
Live.
So yeah.
And this is for men.
This is
so
for
when
men.
we were talking about those 3 common causes.
Yeah, so these are the trocars for the men.
Yeah.
This is
Similar
so
to the
crazy.
women.
And I think the sling is going to be in here.
Well,
If you
'cause
want to open that?
Sure.
Here, let me.
I'm going to
Mike,
put you.
you
I'm
do
going to
that.
put you to work.
It's so
And
fascinating,
I think this is the sling here.
because how we started this conversation, doctor, was that so many people are suffering, and yet, you know, they never talk about it because they wonder, well, maybe it's just a natural part of aging. Can anybody even help me? Please take away that it's not always just a natural part of aging, and there are so many things that Dr. Feloney can do to help you, whether it's urinary incontinence. He also helps patients with erectile dysfunction. He helps women who are also experiencing sexual dysfunction. We are running out of time, but I am so curious to look at all
open. So what do these do real quick?
So those are the trocars for the male version of the sling for men that have had prostatectomies and have developed stress urinary incontinence. And so one of these for each side. It would go basically through here. It would grab it here and pull it. And so the male sling, because men have larger urethras, and this is to help stabilize it and put it back in a position. It would, and it's called the male sling.
And it's incredible. And that
The
stays there
advanced-
permanently?
Permanently, and it helps support and keep that bladder neck and urethra in men post-prostatectomy in place for stress incontinence. So,
Wow.
so men and women they have similar incontinences, different treatments, different treatment options specifically, but broad categories the same. But there's options for them. We can get them help. They can
That's
get
your
fixed.
point. There are options,
There's
so it's
options, and they
it's
can be
nothing to be-
fixed. They don't have to live wet.
Yeah. Don't be embarrassed about it
Thank you.
anymore.
Thank you for
Dr.
coming
Feloney,
in today.
Good to see you.
Thanks for having
Good
me.
to see you again.
Fascinating.
Yeah,
Thanks
it
for
is
having me
fascinating.
again.
Online, it's chihealth.com/urology. That'll connect you to Dr. Feloney and his colleagues at CHI Health.
Yeah, and thanks for the show and tell, too.
I know, we got lots of props.
Charles Dickens' great-great-grandson, Gerald, he puts on this terrific one